everyone, this is Dr. Schroder with this week's video introduction to week number 5 in our course in nursing ethics. Well, we're almost to the end. We have all the case studies are done. All the case studies have been submitted. The grading will be completed by midweek for last week's case studies, and this week's that you just did should be finished later this week as well. And so that brings us to week number 5. Basically, you have two things due this week. One, as every week, is you have a discussion question. And this week's question discusses the concepts of veracity and fidelity. Veracity and fidelity are very important. They're two of the more important and probably two of the ethical values and ethical principles that we in nursing really hold on to. Fidelity is the concept of always being faithful, always being there for your patient. And the discussion question this week will talk about, what are the limits of that? At which point is the nurse giving too much? Or is there a point at which a nurse gives too much? And how do you deal with the ethical dilemma that occurs when you have a patient that needs more than the nurse is possibly willing to give? And that's kind of going to be a interesting discussion this week, I think. Also, going along with that is the concept of veracity. Veracity is always doing what's best. Beneficence is always doing what is right, always doing what is good. Veracity is always kind of being on top of it, always being on top of your game. Veracity means you're always changing, you're always chasing it. You're always trying to do everything that you can do to be the best that you can be. And that's going to be the focus there. And then also do this week, at the end of this week on Sunday, is your posting of presentations for your group presentations that you're going to discuss during week 6. So just to clarify, you're actually finishing those you're finishing the PowerPoints in your groups by this Sunday, by this coming week, and then you're going to be discussing those and giving feedback on those in the final week of class, in week number 6. In week number 6, you have your ethical position paper, and I want to clarify once again that the main focus of that paper, when you discuss your ethical principle, should be the focus on the ethical principles that are inherent in your capstone project or your capstone topic. In other words, if your topic is on some aspect of patient care or some aspect of case management or quality management, the idea is not to write a 5 or 6 or 7 page paper on the role of a case manager, the role of a nursing educator, or the how to give a good bed bath. And it's important to patient satisfaction, with just a couple of paragraphs in there on the ethics. Really, the main idea is to discuss the ethics that are inherent in that capstone. So that's an important consideration. You're going to need to know that and keep that in mind as you move forward in that. Remember to always use headings. Always start with that outline. If you start with an outline and just fill the outline as you go in, you'll find that your papers will read much better. They'll be much better structured. Don't quote, don't include any unnecessary words, and make sure that you work on developing that real concise language. And those, of course, will be due at the end of week number 6. So onward we go. Just like to pray and say, Dear Lord, be with everybody this week. Help us to be always faithful to each other. Help us to always be faithful to our patients. And Lord, give us the strength and the power to be voracious learners, and to be always good and always the best at what we do, because we know that it's in your name that we do this. Amen. And I hope that I see many of you at pinning. I hope that we can get as good a response as we can. I really appreciate and like to see everybody at pinning, so I really hope to see you there. If you miss pinning, it's a neat. You're just missing a lot. So I really encourage you to be there, and to and even if you haven't RSVP'd, please, I look forward to seeing you and to helping with the pinning ceremony. So God bless. Everybody be happy this week. Be well. You're at the end of your sojourn here, your journey, and God bless you. It's good to be with you, and I will look forward to seeing you in class.